I said, well, hey, if I want to look young, I might as well go all the way. Let me get a full head of hair too. So, and unfortunately, I had tried another another company, and it didn't work out too well. And I had already researched this place.
When Charles first came to us, he had been to another surgical center in the past, and he had come to us to kind of fill in what had been created. This other surgical center he had been to had created a frontal hairline, which actually left a football shaped void directly behind the hairline. I felt, in my opinion, that was not a natural form of thinning. So we filled in that football shape and a little bit at his crown to give him a more natural look. And we were able to do this within his budget. When someone comes in and they're interested in a hair transplant, I have to look at their existing hair first. And what I'm looking for is the pattern that we're trying to fill in. Good candidate for a hair transplant is someone with visual loss. I think it's super important that the patient prepare prior to surgery.
And then after that, once they decide that you're a good candidate for it, then she'll start setting things up. When I came in, um, the doctor and his staff, they were very greeting.
The surgeons that I bring in are part of the International Society of Hair Restoration Surgeons. So they're accredited in their field and they have multiple years of experience, multiple surgeries. When I designed these surgical suites, I was taking into consideration the day of surgery and the anxiety a client might be feeling. So I made the rooms large enough and comfortable enough for the client to feel that the day is all about them, because that's what's super important.
It was just a very comfortable atmosphere, I can say. The after surgery care was, I would rate it as above average.
I have put together a at-home kit for my patients, which includes everything they're going to need to properly care for those grafts and for the incision area in the back of their head. We want to make sure that when they're at home, that not only do they have my 3 pages of written instructions, but they have all the tools that they need to feel confident they're taking care of everything the way they should. We send them home with non-woven gauze pads. We send them home with saline, peroxide, water bottles for the mixtures, sterile Q-tips that they can clean the incision area and the back of the head. Even though I haven't had a transplant myself, because my husband has gone through the process twice, I can honestly say I know what it's like to be on the side of being the patient.
And it makes me feel more confident. I'm confident regardless. It's my personality. But having a full head of hair just boosts that even more. But here, it seems as though you'll be treated like family. You feel like family when you come here, and I felt real comfortable with that.